Hello, I'm your host, Amberlynn Carroll. Thank you for joining us on this episode of Medwatch today. When it comes to treating a stroke, timing is crucial. That's why having access to a certified primary stroke center like Munia Regional Medical Center in downtown Fresno can make all the difference.
I knew something was happening and it seemed like a stroke. And I started shouting, looking for help. And so my grandson, who was a doctor, woke up immediately and called 911.
92-year-old Munia Siada was rushed to Munia Regional, where they discovered she was suffering an acute ischemic stroke, a sudden loss of brain function due to the lack of blood flow to a particular part of the brain.
She was brought in, they saw how severe her symptoms were, and then they did some imaging, CAT scan of the brain, was not a bleed. They looked at the blood vessels and saw that there was a blockage of those blood vessels, realizing that she was not a candidate for the clot-busting medications because we don't know what time it started. So if it's more than 4.5 hours, then we think, well, there's an increased risk for bleeding, so they don't get that medication.
Munia Regional Medical Center is the first hospital in the Valley certified as a primary stroke center.
There's a continuum of acute strokes. There are some of the mild ones, usually related to the small blood vessels, and it is related to comorbidities, medical problems like high blood pressure, high cholesterol, uncontrolled diabetes, smoking, obesity, a lot of lifestyle factors. And then there are some of the more severe ones where it's the large blood vessels that are feeding the brain parts that are further out. The ones of the large vessels, actually those can be a bigger catch-all, so it can affect younger and older patients. Some of the older patients, especially over the age of 65, one, they're at higher risk overall because just wear and tear of the body and the brain vessels, but also if they have something called atrial fibrillation, which is an irregular beating of the heart, can allow clots to basically get pumped out from the heart up into these large blood vessels.
Dr. Hana Choe treated Munia and knew time was critical to save her life.
It's almost like a Hail Mary. You have to do everything you possibly can to try to get the best outcome. Otherwise, they will fail, even in the recovery phases of it. In an acute phase where someone is having, or in the throes of an acute ischemic stroke, TPA or clot-busting medications, the other one is tenecteplase. The large blood vessel blockages, it probably got about 30% chance of opening up those larger ones, so those will often take for surgical manipulations where we can try and pull out those clots.
A thrombectomy is a surgical procedure used to remove a blood clot from an artery or vein.
There was no flow to one whole part of her brain, the whole right hemisphere, so she was completely paralyzed on the left side. And then when we were able to pull the clot out, you can see full revascularization, or all the blood vessels to that right side completely normal.
Because of the immediate and local care she received at community, Munia is now back home and enjoying her life.
The biggest joy in my life today is really spending time with my kids. I have 2 sons and grandkids. I'm completely back to normal. I'm more self-aware of my symptoms of a stroke. Dr. Cho's diagnosis, skills, and care had essentially saved me, but also the entire team from start to finish. It was a great experience. Their attention, their care was truly amazing.
Use the acronym BFAST to help spot the signs of a stroke. B for balance is their loss of balance or dizziness. E for eyes is vision blurry. F for face is one side of the face drooping. A for arms are the arms or legs weak. S is for speech, is the person having trouble speaking. And T is for time. Time matters. If you or a loved one are experiencing these symptoms, call 911 immediately.